Wilms tumor is the second pediatric malignancy that I'll be discussing in this series of videos. For Wilms tumor, we'll follow children oncology group staging system, which has 5 stages: 1, 2, 3, 4, and 5. There are no further subdivisions, so it's easy to remember. Stage 1 is tumor is confined within the kidney and there is no breach of renal capsule. So when we do the surgery, when nephrectomy is done, the entire tumor is removed. Margins are negative. And there is no residual tumor anywhere else. So it is complete R0 resection. Coming to stage 2, there may be breach of renal capsule, but however, we are able to remove the entire tumor. So margins are negative in stage 2 as well. The tumor may even extend into the renal sinus or into the renal vein, but however, we are able to remove it as a whole in the nephrectomy specimen, and it is not extending beyond the nephrectomy specimen. So this is also a R0 resection. It might involve blood vessels outside the renal capsule, small blood vessels, but it is R0 resection. Coming to stage 3, there are certain important points to remember in stage 3, which are preoperatively, if biopsy is performed, then it comes under stage 3. And intra-op, if there is surgical spillage, then also it is considered as stage 3. Stage 3 is an R0, R1 resection, R1 or R2 resection. We are not able to remove the tumor entirely. The tumor thrombus can extend into the renal vein and even into the thorax. Suppose this is abdomen, these are lungs, and this is IVC. So the tumor thrombus will extend into the thoracic part of the IVC as well. And there might be peritoneal deposits adjacent to it with direct invasion. And involvement of intra-abdominal lymph nodes. All this come under stage 3. Coming to stage 4, it is similar to any other stage 4 malignancy, which is hematogenous spread. Distant organs are involved away from the site of the tumor. Those are liver, lungs, bones, and brain. Extra-abdominal lymph nodes also come under stage 4. Coming to stage 5, this is bilateral renal involvement. Let's see the theory. Coming to stage 1, this is just for a quick revision. Renal capsule is intact. Tumor is limited to kidney and is completely resected. Tumor was not ruptured or biopsied prior. And the vessels of the renal sinus are not involved. Vessels of the renal sinus are involved in stage 2. Coming to stage 2, the tumor is completely resected. So both of these are R0 resections, and there is no tumor at no evidence of tumor at or beyond the margins of resection. Tumor extends beyond the kidney, but it is confined within the. There might be small penetration of renal capsule or extensive invasion of soft tissue of the renal sinus. Blood vessels within the nephrectomy specimen outside the renal parenchyma might be involved, including those of renal sinus. Earlier, the intra-op spillage or rupture or biopsy was considered as stage 2, but however now they are considered as stage 3. Residual non-hematogenous tumor present following surgery. So stage 3 is R1 resection. Lymph nodes within the abdomen are involved, and tumor has penetrated through the peritoneal surface. Tumor implants found on the peritoneal surface. Gross or microscopic tumor remains postoperatively. Tumor is not completely resectable, and tumor spillage intraoperatively. Preoperatively, the biopsy was done. Tumor is removed in greater than one piece. That is more or less like spillage. A tumor thrombus within the renal vein is removed separately from the nephrectomy specimen. Extension of the primary tumor within the vena cava into thoracic vena cava and heart is considered as stage 3 rather than stage 4, even though it is outside the abdomen. Coming to stage 4, hematogenous metastasis to liver, lung, bone, brain, and lymph node metastasis outside the abdominopelvic region. Stage 5 is bilateral renal involvement by the tumor.